So question number 5, a 19-year-old woman presents to the emergency department with complaints of blurry vision and headaches that started 2 days ago. She reports that she has been experiencing some facial pain, but she thought it was related to her toothache. She is also worried about a black spot that is increasing in size on her face over the last month. She expresses concerns about her frequency of urination. Recently, she had a runny nose through and cough that resolved spontaneously. Patient was diagnosed with type 1 diabetes mellitus at 13 years of age. She is a non-smoker and drinks beer occasionally. Her blood pressure is 122 by 98 and temperature is 37.2 degrees C. The physical examination is normal with exception of a black necrotic scar lateral to the right nasal ala. She has lost 2.7 kg in her last visit, which was 6 months ago. Her routine and urine analysis at the office is positive for glucose and ketones. Which of the following is the most likely cause of the patient's symptoms? So this is a very, very easy and direct question. This is going on too much these days. So we'll read the question first. So basically the question talks about weight loss. I usually start reading from the last part, as everyone knows, okay? So it talks about weight loss and a person with positive for glucose and ketones. Basically, he's having diabetes, okay? I think the person is in diabetic ketoacidosis. Yes. So this is a young patient with positive for ketones and glucose in the urine, okay? Blurry vision and headaches are there, all right. There is some facial pain, okay. And then after the facial pain, there is a black spot present on the face, all right. There will be an image over here like this. So basically, person has facial pain, then he has a black spot, okay. And patient has a history of diabetes mellitus, all right. So this will take, and then as described over here, it's a black necrotic scar on the right nasal ala. So as shown over here, this is something black necrotic scar. This will eventually become black and it will lead to degradation of the nose and your sinuses and everything over here. Okay. So basically this is referring to mucormycosis. Mucormycosis is common in diabetic patients, very common in diabetic patients and in immunocompromised patients, your COVID patients and acidosis and all that stuff. All right. Okay. So someone had mentioned Bacillus anthracis as an option over here. Okay. So this cannot be anthrax because anthrax starts as a painless papule. Whereas over here it is written clearly that the patient has been experiencing some facial pain. Okay. After the facial pain, he has symptoms of runny nose and cough. Okay. And then there's a black necrotic scar. This, I agree, might have confused you for anthrax, but for anthrax, it starts with a cutaneous, painless papule. All right. Then after that, it develops into black necrotic scar. But when it is painful from the beginning and has runny nose and cough, this is more towards your mucormycosis. And mucormycosis, drug of choice, this everyone should know. I need quick answers inside the chat box. Amphotericin, yeah, very good. Amphotericin B. All right. So the drug of choice is amphotericin B. And apart from that, you have to control the diabetes also of the patient because the patient is in diabetic ketoacidosis. All right.
Thanks for watching. Please give a thumbs up and subscribe for more.